My name is Dr. John Song. I'm the medical director of the Advanced Head and Neck Surgical Oncology program here at Northside Hospital's Cancer Institute. I'm also one of the founding members of the Atlanta Head and Neck Associates. I think a diagnosis of any cancer is difficult, but a diagnosis of cancer in the head and neck, which can affect so many functions that we take for granted, such as speaking and eating and drinking, can be really devastating. So part of my job is to educate the patient and let them understand what their options are. There is no one-size-fits-all. One of the great things about Northside Hospital and this Cancer Institute is that there is a depth and a breadth of treatment opportunities here for the patient that rivals any university program that I've ever been associated with. So not only are you able to get community care locally, you're really getting world-class care. The one thing that I wanted to do in the next phase of my career was to try to bring a more personalized approach to cancer care. So from the minute you walk through our door, you'll be greeted with warmth and kindness and a smile. You won't be rushed. We will take the time to take care of you. I've got a clinic staff that's warm and friendly, whose joy it is to take care of patients. I think what Northside has allowed me to do is put together a world-class team, but still provide individualized care in a community setting. And that is so rewarding for me. When we take care of you, we're taking care of the patient. We're not just taking care of your cancer. One of the great things about Northside is how well people work together. We have a weekly multidisciplinary program where we bring together all the experts in head and neck cancer from all of our hospitals in the Atlanta metro area. That means that you benefit from having access to not only my opinions, but also the expertise of all of the physicians who provide care for our head and neck cancer patients. That would include our radiation oncologists, our medical oncologists, our geneticists, and everyone who's involved with the care of this patient. So when you see someone here at Northside, you are benefiting from the entire network of our physicians and our hospitals in the system. Because head and neck surgery is still a relatively rare cancer, you really want someone who's had a lot of experience in this field. One of the benefits of seeing a head and neck surgeon here at Northside is that we're all high-volume surgeons. This is all that we do. So you have access to our years of expertise. You will have access to the latest technologies, and you will have access to the latest surgical options, including complex reconstruction, if that is appropriate. You know, this part of the body is so important for so many reasons. You know, your appearance, your function, such as speaking and swallowing, are all affected by cancers of the head and neck. So part of what we need to do is to not only treat the patient and make sure that the cancer is cured, but we also have to do so by maximizing function at the end of the surgery, and also to minimize long-term effects to patients' speech and swallowing. And so we are trying to provide an entire spectrum of services to allow the patients to have maximum return and maximum return to life after they've beaten their cancer.